Hi, everybody. Thank you for taking your time out of your Monday to come join us here to talk about a pretty important subject. I'm really here to focus on sleep apnea and specifically CPAP therapy for sleep apnea. For those who don't know me, I'm Dr. Arora. I am based in San Diego, and I actually have the pleasure of traveling up here to work at a Pacific Sleep Disorder Center. I don't see a lot of familiar faces here, but maybe one. Pleasure to be here to talk to everybody about sleep apnea, and specifically CPAP therapy for sleep apnea. Just as a show of hands, who here has already gone through the sleep study, on treatment, and now using their CPAP, whether successfully or unsuccessfully? Good. Just to talk a little briefly about sleep apnea in general, I describe sleep apnea to patients as just essentially your body choking yourself at night. As you can see through the AV visual over there, the choking can happen anywhere along the airway, whether it's through the nose, through the tongue, down at the neck. And certainly when we're sleeping at night, we don't want these outside forces choking us, essentially preventing us from getting everything we want from our sleep and really causing us to wake up behind the eight ball, so to speak, tired and groggy. Sleep is something that every organism needs, and if we're constantly combating a closing airway at night, we're not getting everything we need to out of sleep, and certainly making our physicians' jobs a lot harder, and really impacting the quality of our life as well. When we talk about sleep apnea, we typically are talking about the more common type of sleep apnea, which is obstructive sleep apnea, essentially the mechanical effect of our body choking ourselves at night. Sleep apnea is something that does get worse as we get older. We're just not having as much muscle tone throughout our body here. Our muscle is changing into fatty tissue, and sleep becomes a very vulnerable time because all the muscles of our airway relax and collapse. Typically, the first thing we hear about here is snoring, and it's typically very loud, obnoxious snoring that disrupts our bed partners as well. We certainly get worried when the snoring becomes associated with the more serious closing of the airway, the gasping at night, the choking at night, our bed partners making sure we're still alive and breathing at night because all of a sudden the snoring just seems to stop. I will say sleep apnea is more common as we're getting thicker in the neck as well. The neck becomes the most vulnerable part of our airway, and when our neck collapses, everything becomes worse, and it is associated with that weight gain. And weight gain is something that just happens as we get older. And it's harder to lose that weight as we get older, which really makes the problem become much worse and really starts this vicious cycle of poor sleep, inability to do the things we need to during the daytime to maybe help lose the weight. The sleep continues to get worse, and all of a sudden medical problems are beginning to develop, and our doctor's jobs are getting harder. And now all of a sudden we're faced with a very serious condition. Fortunately, and really to talk more about the treatment of sleep apnea, there is an excellent treatment for sleep apnea that can essentially remove this from the healthcare equation, which again, from what I've seen in the show of hands, many people have already been introduced to and are using. That treatment is called CPAP, or PAP therapy in general. CPAP standing for continuous positive airway pressure. Basically, it's air pressure, typically humidified air pressure, that is entering our airway either through our nose or our mouth. And all that humidified air pressure works as a, splint to kind of keep everything in an open position. And effectively, it removes sleep apnea from the healthcare equation. Really, this isn't the only treatment for sleep apnea, but doggone it, it's the most effective treatment. And really why we're harping on it and why we really help, people don't to give up on this, really keep at this, because this is something that will add years to your life. It will make your doctor's jobs easier. It keeps patients away from lovely facilities such as this and in their own home. CPAP therapy, as people know, and as you could probably attest to, is not the easiest thing to get used to. It takes a little bit of time. It takes a little bit of perseverance. But from people who do very well on the treatment and what people would tell you, it can really be a lifesaver. It can really be a game changer for people. As a quick show of hands, how many people here doing very well on their CPAP, sleeping like a baby, no complaints whatsoever. Yeah, that's what I expected. Now, how many people here are struggling? How many people are having some problems with it? Sure. I'd actually be curious. Certainly, I have my own ideas for what's going on, but just, we're a very small, intimate group here. What kind of problems are you having with your CPAP therapy? Just shout it out for me.
Air escaping from the nasal passage.
Air escaping from the nasal passage.
There's times I can't get to sleep. I stay awake all day, all night, and maybe get an hour's sleep. And when there's days I have good days, I can sleep 8 hours with that sleep. It's good. But getting to sleep is the problem.
Beautiful. These are the two things that I was glad to bring up. Starting with what you're saying, sir. Sleep apnea is a luxury if we can't even sleep at night. And there's obviously a lot of things that go into sleep beyond just the airway. Really, we're going to focus more on the CPAP therapy here, but I'm really glad you brought that up because insomnia is another very serious sleep problem that sometimes the CPAP will help, but sometimes it's a separate thing that we treat separately or we treat complementary to the CPAP. I would say the mask is really the hardest part of this treatment. We have to have something that is attached to our face that allows the air pressure to enter our airway. And as many people could probably attest to, there are multiple different masks out there, and many people have tried all these different masks. I would say the mask is the biggest reason that people discontinue their CPAP therapy or really are looking for alternatives to their CPAP. And we're fortunate nowadays to be in a, let's say, era to where the technology is constantly changing. And we have lots of different entities working on making good masks and making that treatment as comfortable as possible. I would say most people have the most problems with the full face masks, the masks that are coming down and just covering everything. This is a mask that tends to cause more claustrophobia. It's a mask that tends to take more real estate on the face, and especially if we're sleeping on the side, that thing just kind of juts loose and air is escaping everywhere. And let alone, we have our own difficulties in sleeping, and now we're dealing with this mask that's just leaking everywhere. I liken CPAP, as many people may have heard, to it's like learning how to ride a bike or it's learning how to drive a car. We can all remember when we were first doing these things, it was scary. It took some time. It took a lot of perseverance and patience and practice. Now, we look back at those days and we don't even think about driving anymore. I mean, riding the bike, it's almost like a skill we've learned, and we don't even think about it anymore. And especially with the people who have been through CPAP through months, years, it becomes second nature to them. Have any of you had any friends or family who say they can't even sleep without their CPAP? Like they just have to wear their CPAP at night.
That's myself until I had to get a new one, and the noise is what makes me nuts. I put up with that for about a year so that I would own the machine, and I got it traded out about 2 weeks ago. And I don't understand it. I don't know why the noise isn't consistent. It doesn't make the same noise if I bring it into where I got it as it does when I'm at home. And it's just driving me nuts.
Now that's interesting as well. I'm glad that we're joined by a lot of leaders in the field here and a lot of our sponsors here who really can help kind of with the nuts and bolts of that as well. And again, I really want to spend most of my time here doing an open question and answer. So hopefully I can provide some of my expertise and thoughts to things that can make this treatment go from where you are at now to where we want to be. Because really, I think the reason we're all here today is we recognize how important this treatment is. We recognize that this is something that really can help us. And unfortunately, nothing good in life comes easy. I would say CPAP is one of those as well, but really the upside of it is significant. And we can get there. It just takes a little bit of time and perseverance. And oftentimes, the first mask isn't the right mask. Oftentimes, CPAP is not the right machine, and we need to use machines that will adjust the pressure a little bit, or what we like to call a bi-level device. Again, this is getting into more advanced parts of sleep apnea here, which I'm happy to touch on, especially if you have anybody with interest with that. But really, I want to spend more time now just kind of hearing from you. What difficulties and struggles have you had? What would be something that would allow us to make the best use of our time here. I mean, you spent your evening here to talk about some CPAP and sleep apnea. So I'd like to hear from you all about what is important to you and what are some of the difficulties you're going with. And I'm glad we have a very small, intimate group here to really spend some one-on-one time talking to people individually about this. With all that said, I'd like to just hear some questions or some other thoughts that you guys have about sleep apnea. Again, just raise your hand, shout it out here. Again, very informal. I'm here to really to help everybody here.
One of my friends who couldn't be here and wished she could asked me to find out, what do you think of the automatic CPAP cleaner machines? Are there good ones and bad ones, or are they not worth the money, or what?
You know, maybe 4 or 5 times a day I get asked that question. Those people, they're doing a pretty good media blitz on getting their product out there. CPAP has been around since the 1980s. This device you're referring to, the Soclean device, is a fairly new device that's just come around the past couple years. I would say something like that, it takes a lot of the grunt work out of the CPAP. As people here have had CPAP, we know that things are getting dirty. The tubing is getting dirty. Oftentimes our houses are very dusty. We have pet dander, and it's hard to keep up with the upkeep of cleaning the CPAP device. But this is also the air that we're breathing in, so it's imperative that we do keep it clean. I think the Soclean device is excellent, actually. I think it is something that would be very beneficial to everybody. The real world issue that becomes is this is a device that's made by a company, and this is not something that is covered by insurance. This is something that is requiring us to reach into our pockets and spend our money for it. And if you have the income for it, if you're not very good about keeping up with cleaning the CPAP, I think it's an excellent device. But as I said, CPAP has been around since the 1980s. In my view, something like that is a luxury at this point. And this is what the insurance companies are viewing this as well, a luxury.
So is there only one kind?
The main kind that's come out that's getting this media blitz is called the Soclean device. Now, I do believe there are some other versions of that as well that essentially do the same thing where it desanitizes the device.
Okay.
Like I said, these are not things that are standard of care, but I do think it is a luxury, and there is a place for luxury. Now,
but it does work, and it does do the job.
It does do it does do a job. Absolutely. Thank you for asking that. Actually, I thought I was going to get asked that question. So, is there
One
any
of the things that irritates me is when I have the mask in the morning. I wake up with these indentations.
Mm-hmm. You're getting that mask on pretty tight, right? Preventing that air leak.
Yeah.
Sure. I'm guessing it's a full face mask you're using?
No,
just a nasal mask. Mm-hmm. You know, the CPAP mask. If it's leaving straps on if it's leaving marks on our face, we're over tightening it. The CPAP mask should make a nice air seal. When we breathe in, the mask should just stick automatically. Now, oftentimes, if the pressure of our machine is too high, then this kind of makes the mask come loose, or it gets the air to come out of it, and we compensate by just tightening it. When we're seeing those marks on the face, what we really need to think about are 2 things. A, is this the right mask for you? Should we try a different type of mask? And B, how does the pressure feel? Maybe the pressure is too high, causing the mask to leak, and starting these cascade of events that just leave these marks on our face and the discomfort with the treatment. These are things really to talk about during your visit with the sleep doctor, but this is how I approach it, is essentially, is your mask the right mask? Because as you know, there are 50, hundreds of different types of masks out there. And for many of these masks, it's trial and error. We just have to try one, see how it goes, see if we can get used to it. If it works, great. And if it doesn't, we try a different one. This is why I say the mask is really the hardest part of the treatment. But the other thing we have to think about is the machine just blowing too much pressure? Are we essentially causing this mask to leak by just setting this machine too high? And for a lot of people, maybe we can get away with using a lower pressure, but there's a balance we have to use. We don't want to give too low of a pressure to where the problem is not being resolved, but then too high of a pressure to where the mask is coming off and it's drying our mouth and it's just leading to more problems. I would bring that up during your next visit with the sleep physician, because I do think this is a very common problem, but it's not something that we can't resolve. Right back there. I know you had your hand raised as well.
I was just wondering, I did the sleep study Sunday, and actually my appointment's with you tomorrow. Find out what you say. I'm a mouth breather, and I sleep on my side or on my stomach. How's that gonna work?
Yeah. So again, with the mouth breathing, couple of thoughts that come to that. If our nose is congested, our mouth just naturally comes open at night. And actually, mouth breathing makes sleep apnea much worse. When we open our mouth, it actually starts to push our chin back a little bit and just narrows the airway naturally. So oftentimes what we can do with the mouth breathing, and something that actually gets better, is the CPAP. If we just force the humidified air, force isn't the right word, if we just apply that humidified air through the nose, sometimes it actually opens up the nose, and all of a sudden, we're able to breathe better through our nose. We actually aren't sleeping with our mouth open at night. Unfortunately, sometimes the mouth breathing becomes a habit, and we have the full face masks to kind of help combat that as well. Again, sleeping with the mouth open, and then on the side, and with the full face mask, it's probably going to lead to some more leaking problems there. Again, it's something that's been thought of before. How many of you are familiar with the CPAP contour pillow, or the pillows that actually have the little divot on it? Have any of you seen these at all? The whole idea behind that is because it's such a big problem that they've actually manufactured a pillow that has a hole right there in it. So your mask just sits right there, and it actually will allow your full face mask to stay on without dealing with that leak. It's called the CPAP contour pillow, and it is something that can make a big difference as well. We want to use the smallest mask possible. And if we are able to use a comfortable mask, and, what some patients tell me, they train themselves to sleep with their mouth closed, all of a sudden the air is going where it needs to go instead of escaping right from here, leading to this suffocation on treatment or feeling like they're not getting enough air. How many of you have had that experience where it feels like, yeah, extremely common problem? Again, the full face mask is the thing that kind of just allows you to sleep how you normally sleep with the mouth wide open and keeps everything covered. But as I alluded to earlier, the full face mask takes a little bit more getting used to, especially when we sleep on the side. I will say though, everybody has their own sleep position. Everybody here has been sleeping for all of your life, I would say? You've been sleeping? Yeah. And now all of a sudden we're putting this mask on your face and telling you to sleep with that there. We don't want to change your sleep too much. We don't want to reinvent the wheel so much to speak with how you're sleeping. But if we are able to sleep on our back, it does actually make the mask seal a little bit better. But sleeping on the back will also make sleep apnea worse. And many people with sleep apnea have trained themselves to sleep on their side. And it's hard to go back to sleeping on the back again because some people actually notice this is when things are closing. This is when the snoring is getting louder. This is when the bed partner has given them the elbow to roll onto their side at night. This is part of the growing pains with CPAP, I would say. I wish I could tell you there was a good answer for that. I will say sometimes we are using a hypnotic aid, something like an Ambien or a sleeping medication, just to kind of take the work out of sleep so that the machine can do its magic. I'm not going to talk too much about sleeping medications, except to say they should be short-term. They should be used as something to make sleep a little bit easier while we're getting used to something like the CPAP or treating the sleep apnea. But I guess that's a long-winded answer to say I've seen that and it will get better. It just takes a little bit of time. Just like anything else, it will take a little bit of time. But the hope is that maybe we can use a mask that isn't taking so much room on the face that will allow us to sleep on our sides a little bit better. Yes.
I would just share my experience related to those things because I used my CPAP religiously for probably 10 years. And before I had it, I was living on allergy pills because I couldn't breathe through my nose. I was allergic to everything all year round. The first night I had the CPAP, no more allergy pills.
Huh.
Not during the night, but even during the day. I've now had 5 years of no allergy pills. Something like, 10 years. That's how long I use the CPAP with almost never an allergy pill. I also have to sleep on my back for reasons of my spine and my knees. And I know how to adjust my pillow and everything else, and it works just fine.
Mm-hmm. This is wonderful. And this is why I'm glad that we have a very small, intimate group here, because so much about CPAP, and especially getting used to it. As we can see, it's a very common condition, but the support that other patients can give each other, it really goes a long way. It really does. Yes.
My experience is just totally the opposite.
Uh-huh.
I've had allergies. This is aggravated to no end.
Mm-hmm.
I will wake up in the middle of the night. I have so much mucus in the roof of my mouth. I literally have to take a wash rag and wipe it off. Last night I had to do it 2 or 3 times. It just stuck like glue to the roof of my mouth. The other thing is I'll wake up and I'll sneeze. And the other day I got up, maybe got up at 6 o'clock. I started sneezing, blowing my nose. My nose was running, and that went on until about the middle of the afternoon until it finally would release. In fact, my primary doctor has sent me to an allergist, and I'm now on allergy shots. Is helping some.
Okay.
But my experience is just the opposite.
Which is interesting. Well, while I can't give individual advice on that, this does sound like something the CPAP may be exacerbating, but it's relatively unusual for it to be, I would say, to that level. Especially if we're keeping our equipment clean, changing those filters, using the humidifier. That is actually a very it sounds like a very awful experience, actually, and I think it's no surprise that it's a struggle to use the CPAP at that point.
And then I wake up, and I'll wake up 2 and 3, sometimes 4 times a night. So I'm not really getting the rest I should get.
Yeah. The treatment sometimes becomes worse than the disease, so to speak.
Every time you put it on, then you can't get the leakage to stop.
Yeah. This when you meet with your sleep physician next, these are definitely things that I would bring up. I do think that these are things that we can combat. I would actually agree and applaud with your primary care's decision to send you to an allergist to see what are some of the other things that might be putting you behind the 8 ball, so to speak. That's just going to make something like the CPAP harder to tolerate. I'm sorry to hear that you're struggling with it there, but I hope that you can persevere and stick with it. Again, if you are unable to, there are alternatives to CPAP, and these are things that really should be discussed. The CPAP doesn't do anything if it just sits in your closet. It doesn't do anything if we're not putting it on at night. And if it really gets to that point to where we're not using it, I have to say we really should meet people with where they're at and think about what are other things we could do to help solve this serious condition instead of, putting everybody in kind of one box there. But I will say there's nothing quite like the CPAP. There's no treatment like the CPAP, which is really why we encourage people to stick with it and why we really want to give this as best of a try as we can. But try as we may, if it just doesn't work, that should be a conversation that you aren't afraid to bring up with your sleep doctor. What is other things out there for this? Especially if we've done everything to help with the CPAP, if we've tried the different masks, if we've gotten the top of the line equipment and it's still not working, we should meet people with where they're at. And so I hope that we can figure this out for you. But if we can't, all hope is not lost. There are other ways to treat this condition, but the CPAP is really what works the best.
I'll share one more thing on
Yes.
that, and I'm sure it's not her problem, but one time I actually woke up and sneezed during the night, and I couldn't understand it. It never happened before, and it took me several days to discover that the filters had fallen out of the bath.
Oh,
and
no.
I was breathing unfiltered air and didn't know it.
Wow. And again, I think these are one of the things that come with the upkeep of the CPAP. It's a lot of things to start keeping track of, especially when we just haven't do that for all of our sleep lives. But that's really interesting. I'd say the filter is probably one of the most important things to keep changing regular and keeping the upkeep up. Again, that's the air we're breathing in. A lot of people can get away with washing their mask or reusing the tubing for 6 months, 1 year. I've seen people, have the same tubing for 5 years, and they still are able to get what they need out of the treatment. But the filters, that is something I think is vitally important to change, especially when we're living in a dusty place or we have a lot of pets at home. I think this is what exacerbates the sneezing. I think this is what causes some more of those allergies to start developing if we aren't keeping that air filtered and clean and humidified.
Let's ask a question. My doctor says I have a restless leg syndrome. So I take the pills, but sometimes at night I wake up with my leg shaking. And is there any exercise you can do? I mean, what I've learned now is just keep pushing myself until I'm dead tired. Then I go to sleep, no problem. But is there an exercise you could do, before you go to sleep? Any exercise you could do to
Yeah,
slow
yeah.
yourself down, get sleep.
You know, I'm glad you asked that. You know, restless leg syndrome is another serious sleep disorder, oftentimes not related to sleep apnea or CPAP. Just to touch on it a little bit here, and to answer your question, hot showers at night, a hot shower just to kind of loosen the muscles of your legs can help with that as well. Especially if there are specific areas of the leg that seems to be the problematic area, really kind of stretching that out. And you hit on another important point, working out those muscles during the day. Tiring out and fatiguing those muscles will help with the restless leg sensations. Oftentimes we do need medications for that, and oftentimes there are other considerations we think about for restless leg syndrome. To answer your question, warm showers, really stretching out and loosening those muscles at night can help out a lot for restless legs. It's a very good question. Again, kind of beyond the scope of what we're talking about today, but I'm glad you brought that up because it's another serious sleep disorder that does impact our ability to sleep and our ability to tolerate the CPAP. Yes.
Yeah, I have allergies, not all year long, but a certain time of the year that I have allergies. And I've noticed too with the CPAP that I'm a lot better.
You are.
Yeah, I have a few days where sometimes I struggle, but for the most part, the CPAP has helped a lot.
And that's wonderful. And this is wonderful as well. You know, I think you have a lot of support in this room, ma'am, that kind of other people who are doing really well on their CPAP with the allergies. So I'm very happy to hear that because we don't know what the role of sleep apnea is in somebody until we start going after it and start treating it. And for some people, it makes a big difference. And for some people, maybe it doesn't make a big difference. But it's a pretty low-risk intervention with potentially high benefit. And really, that's what we should be about in healthcare nowadays. Low risk, high benefit. And that is what CPAP is. You know, if one bad night of sleep, which we all have experienced nowadays, with the CPAP, if this can lead to now more better nights of sleep, I mean, this is what we're going after here. This is the upside. And I'm glad that you persevered with it and kind of got through those rough times because things do become a lot better when we can tolerate this treatment. Yes?
I was just going to let the gentleman in front now. I also have restless leg syndrome, and I suffer from fibromyalgia and neuropathy. And I've been going to the swimming pool. YMCA in Stockton has like 4 or 5 different pools, and it's like $2 to get out.
Mm-hmm.
That and then the hot shower at night, and if you massage your legs down, it has helped immensely because I would sleep 15, 20 minutes.
That's wonderful.
And be at the other end of the bed, all over the bed, trying to make the convert to sleep or legs. So
I'm so glad that works for you. Actually, that's wonderful. Wonderful.
it helps to move, yeah. And for me, it's hard for walking. So in the water, it's wonderful.
Yeah, it does tend to be a little bit easier on the knees, and it's a great aerobic workout. So I applaud you for being able to do that and to stick to it as well. That's great. Are there any other questions before we get to more of the discussion of the masks and looking at the machines and letting some of our sponsors take over here?
My question is just about the machine, so maybe that comes in the next part, and why this noise does what it does.
Yeah. Again, it is unusual to hear that, especially from the newer machines, that it actually seems to be louder and more noisy. Again, my initial thoughts is, is the pressure different on your new machine? Is it a much higher pressure that's now all of a sudden causing some more whooshing noises? Is there some kind of break in the circuit to where the air is escaping from before the tubing or from the device?
It's more complicated. I've tested all kinds of different things, and it changes depending on my body position even. And it's not the same every night, even though everything else seems to be the same. So,
yeah, and again,
it's confusing.
Yeah, well, and the beauty with the devices nowadays is this little data chip in the back of it. When you come to see your sleep doctor, we're asking you, did you bring your chip? Did you bring your chip? Because that chip gives us a lot of information about what's going on. And oftentimes we can look at things from the chip and it coincides with what patients are saying as well. So it makes the treatment a lot more easy for us to understand what's going on and gives you a little input into how is this machine doing? What are my numbers looking like? So, it's a very effective treatment. It's something that has gotten a lot easier as time has gone on. And, it's really gratifying to see people doing well on it because for many people, this is the answer they are doing so much better on the CPAP. You know, it's almost like a renewed lease on life again. And again, it's wonderful as a healthcare provider to see, and it's wonderful, I think, as a patient to experience. So stick to it. Yeah.
Is sleep deprivation sort of a habit that you have to break?
Is sleep deprivation sort of?
I don't know if I'm phrasing
No,
that.
no, you are. Sleep deprivation as a habit. You know, I would say insomnia, which is kind of related to sleep, that becomes a habit. You know, most people don't develop insomnia overnight. They don't all of a sudden lose their ability to sleep. This is something that's typically developing as we live our life, especially as life throws curveballs at us, and we take that stress to bed with us. And now all of a sudden the bed has become the place where we're thinking and problem solving, and all of a sudden
we've created a bad habit of associating that bed with not sleeping. And that becomes a habit. Then now, night after night, we become to associate that bed with not sleeping. We're getting less hours of sleep, and now becomes a habit that's hard to break. But we can break it. It really just requires us to start, simplifying our life. You know, begin to associate that bed for what it's supposed to be about: sleep, rest, relaxation. I would say nowadays, and again, this is kind of going beyond the scope here. I'll get off my sleep soapbox after this. We tend to live very complicated, stressful lives, especially human beings, compared to any other animal out there. And when the bed becomes an extension of that, our own abilities to sleep become compromised. And when that starts to happen, the CPAP becomes harder to tolerate. This is when the sleep deprivation and the insomnia becomes a habit. And those habits are hard to break. I'll close with this. Sleep apnea is a relatively easy disorder to treat. Insomnia, sleep deprivation, stress, those are much more difficult. Those really require us to change certain things about how we're living our life, or confront certain things so that we can go to sleep at night. Have you guys heard that phrase, whatever helps you sleep at night? No? Okay, yes. Essentially, the whole idea behind it is there are a lot of different ways to get to sleep at night, but the whole idea is we only go to sleep when our mind is clear. And if our mind is cluttered, if our mind is constantly dealing with things in our waking life, we don't sleep. We just lay in bed and the brain continues to try to resolve these things. But that's not what we're supposed to be doing at night. And I think it is part about how we as human beings are living our life now. We are not living more robotic type lives and more stressful lives compared to, you know, how you say, our ancestors, or how early man was living their life when things were a little bit more simpler. I could talk hours about insomnia, but again, it's kind of beyond the scope of what we're talking about here. But it is extremely important, and I'm very glad that you brought that up as well, because I think that is really a nice microscope into how we are living our life. You know, when we aren't sleeping at night, we really need to think about what is preventing us from sleeping at night, because sleep should be automatic. Sleep should be as natural as waking up. Yes, last question here.
Doctor, are there any academic textbook, not necessarily textbook, but books that are easy to read for the common person to understand that kind of covers a lot of these subjects you're talking about?
Sure.
Read about?
Sure. I am aware of a couple of very good books that I recommend for insomnia, and I'm happy to give you the names of those books. Absolutely. Sure. Absolutely. You know, I think there are plenty of good texts out there. There's plenty of bad texts out there, but there's plenty of good texts out there. And the more we understand it and the more knowledge and perspective we have, the more we know how to cope with this. All right. Thank you guys for allowing me to speak. It's been a pleasure.